Hello, YouTube. This is Beth DeNapoli with Otsuka Pharmaceutical Development and Commercialization. Recently, PsyQ hosted a webinar titled The Impact of Adherence in Patients with Bipolar I Disorder. During the discussion, our speakers, Drs. Martha Sajatovic and Joseph Goldberg, examined barriers and facilitators of medication adherence in individuals living with bipolar I disorder. In addition, our speakers reviewed approaches for improving medication adherence and discussed the potential role of long-acting injectables in the treatment of bipolar I disorder. As always, the presentation was sponsored by Otsuka Pharmaceutical Development and Commercialization, Inc. and Lundbeck LLC, committed supporters of the mental health treatment community. Speakers are paid consultants to OPDC, and I am an employee of OPDC. Let's look at a few clips from this webinar.
This 20% is a threshold, right? A lot of individuals with not just bipolar disorder, but other serious mental illness conditions may go for extended periods with no medicine or sort of punctate. I ran out, it stopped, I didn't refill it, I want to see what would happen. There's a story oftentimes behind every instance in which non-adherence occurs. So we could sort of take the clinical trials world where one is proactively tracking adherence and asking patients about it, or doing pill counts or accountability of medications. And then I think in clinical practice, I will almost forecast for patients, look, it's really tough to take medicines on a long-term basis. And if you happen to have bipolar disorder, very often you're taking multiple medicines. We published a study recently about a third of bipolar disorder patients take 3 or more psychotropic drugs, and that's separate from their non-psychiatric medicines. So the reality is, what can I do on the front end to be helpful to you as an ally in this? What makes it hard to take medicines? Do you find it's divided up throughout the day, and so you forget whether you took it or not? Could we simplify a regimen? We'll talk more as we go along. Is it concern about side effects? Is it a sense that I'm well now, I don't think I need it? I'll almost forecast for the patient that it is common for these questions to come up, and I just ask that they loop me in, because the worst thing is if someone decides, stop my medicines, and Dr. Goldberg doesn't need to know that. He'll be judgy about it, which I really don't want to be at all, because we can try to make it a more mutually satisfying experience to be in treatment.
We can say some things generally and then some things specifically around bipolar disorder. So, Joe had mentioned that people with bipolar are frequently on multiple medications. We've seen in many of our studies that it's common for suboptimal adherence to occur across multiple medications, and if somebody's supposed to take something in the morning, they will often miss their entire morning medications. If you look at the research literature, you generally see that there's no drug, generally for foundational BD drugs, nothing that sort of pops out that says, oh, people are really adherent with this or not. The one exception that there is in the literature is if somebody's taking a short-acting, immediately sort of felt medication like a benzodiazepine, or something as needed, you tend to see higher rates of adherence with that. But that's not usually what gets people into trouble. It's usually the medications that are foundational BD medications that they miss. But I also want to say that, we talk about rates of poor adherence or specific drugs, but those are numbers that reflect a longitudinal history, right? But what happens over shorter periods of time, a few days in a row or a few weeks in a row, is often what can tip that balance. So what I would, caution our listeners out there is to say, oh, I can rely on something like pharmacy refill records to direct me as to whether my patient is taking their medication. That might give you some indication. So if somebody has not picked up a medication from the pharmacy, they're probably not taking that medication. But just because somebody brings the medication home, we don't know that they're ingesting that medication regularly. So I would say the rates are helpful. They let us know that it is very common to miss dosing of medication, but it's really going to be that interaction in the clinical setting that will help the clinician know is there something in particular going on right now that I should be aware of that we have to have a dialogue about?
Thank you for watching our YouTube teaser. If you'd like to watch the entire presentation on psychu.org, please click the link in the description. You can take a look at our upcoming webinars while you're there as well. Be sure to follow us on Twitter, LinkedIn, Facebook, and Instagram, and have a great day.